So read the scenario and then we will start. Okay, so what will you do in the management of this patient?
Okay, this patient is a victim of a road traffic accident, so I will call for help and uh, manage her according to advanced trauma life support protocol, that is to uh, manage and assess airway and vital span stabilization, breathing assessment and management circulation, and I with disabilities.
Okay, so how will you treat the hypertension in this patient?
Yes, in this patient, I will secure IV access and then take samples for every blood investigation. Then also commence IV fluids with scale salads. Then 1 liter, 1 to 1.5 liter in 1 hour. Looking for any other place for hemorrhage, for obvious external hemorrhage to address, and peripheral, outside, or inter. So if, and then I will monitor the response to the fluids I am giving. That is the blood pressure, to trace the pulse rate, tachycardia to improve, then the urine output to also improve. If I have assessed fully that there is no excellent bleeding, and I do my focus assessment sonographic for trauma, I assess the pericardium, the liver, pelvis, spleen, there is no bleeding and there is no response. So that is most likely uh, associated spinal injury the patient has. It might be the responsible for the aggravation.
So what type of shock has developed in this patient?
In this patient, it will be uh, spinal. It will be uh, it will be spinal shock, spinal or neurogenic shock, neurogenic shock.
Okay, so can you differentiate between the neurogenic and the hypovolemic shock?
Yes, in neurogenic uh shock is a shock that there is no. I mean, in hypovolemic shock, it's a shock that results from fluid or blood loss, from blood loss or from fluid loss. While in neurogenic shock, it's a shock that that results not from fluid loss, but from loss of vascular tone. And in hypovolemic shock, the shock, the hypotension is usually corrected by fluid or blood replacement. While in neurogenic shock, replacement of fluids, fluid resuscitation or blood resuscitation will not give rise to, it will not correct the hypotension. There will be needs to use uh, vasopressors like dopamine or no adrenaline.
Okay. So can you appreciate the findings in this CT scan?
Okay, I can see this is an MRI. This is an MRI, a longitudinal view of MRI that shows fracture of L3 lumbar vertebrae, the body of L3 lumbar vertebrae with posterior and anterior displacement. A comminuted fracture for that matter with compression of uh, the segment scale of the spinal segment, or rather the compression of spinal nerves at the segments.
Okay. So what scoring system you will use in the assessment of this patient?
Uh, and you come back to backs. I want to speak backs.
Okay.
I want to speak it.
Okay,
Man.
sure. That's totally fine. So, what could be the clinical picture of this patient?
Okay, this patient will present with paraplegia, most likely urinary incontinence, most likely equine incontinence.
Anything else?
Also most likely dysfunction and most likely loss of sensations as well of the lower lips.
So, why erection could be spared in this type of injury?
Yes, erection could be spared in this type of injury because and this in the vulvocavalus in vulvocavalus reflex can be intact in this type of injury, and the lesion is at the cauda equina, not on the substance of the spinal cord itself. So uh, the compression, there are nerve roots compression may not be total, may not be complete.
Okay. So, can you describe what is Brown Sequard syndrome?
Okay, Brown Sequard syndrome is a spinal cord lesion. It's a spinal cord injury. It's a syndrome that results from spinal cord injury that involves loss of motor and spatial senses like radio sensation, triple discrimination, joint positional senses, ipsilaterally on the same side of the lesion, and contralateral loss of pain and temperature.
Okay. So, what are the long term complications that can develop in this patient after this type of injury?
Okay, long-term complication in this patient include bed sores, development of preaxial muscle stiffness, joint stiffness, muscle wasting, uh, recurrent urinary tract infection because of inability to pass urine and prolonged inguinal unilateral catheterization. Uh, uh, yes, and maybe psychological uh, issues like depression.
Okay. So, how will you manage all these complications? Just give me an overview.
Okay, management of these complications involved the use of multidisciplinary approach to involve spinal or neurosurgeon, physiotherapists, uh, patient counseling, patient and patient relative, hypnosis, uh, specialist nurses that are that specialize in managing patients with paraplegia or with spinal cord injury, and orthopedics surgeon. So it involves uh, uh, regular training of patients to prevent bed sore, good hygiene, use of good linens, bed linens, use of pneumatic mattress, regular change of catheter, using antibiotics to treat various obvious features of urinary tract infection, and physiotherapy is also regular physiotherapy to prevent joint stiffness and muscle wasting, and also regular patient counseling psychiatrist to prevent depression.
Okay. So, now we'll come to the remaining question that what scoring system can be used in the assessment of this patient? So, we can use the revised trauma score, the GCS score, and the trauma score injury severity scale. So, these are the three scales which we can use. So, rest of your answers were pretty much okay. So, when you were telling about the treatment of hypotension, just don't go into that much detail. Okay. Just tell that
Okay.
she will get the IV lines, get the fluids, check, send for the cross match, and then check for the response of the patient. Because you might waste your time in answering that question, and your remaining questions can be skipped. So, that is the one trick to manage all the questions.